In today's video, we will be discussing the symptoms of hormonal imbalance in women. Can weight gain be due to hormonal fluctuations? What about skin darkening and skin tags? Is night sweating a symptom? Let's begin. Hormones are chemical messengers produced by endocrine glands and travel within the body via bloodstream. Basically, hormones tell the tissues and organs what to do. But due to various reasons, your body may find itself struggling with a hormonal imbalance. There may be too few hormones or too many. But how can you know if you have a hormonal imbalance? Here are a few symptoms that can help you identify this issue. Infertility. Though there are several factors responsible for infertility, PCOS is one of the leading causes. This endocrine condition interferes with ovulation. PCOS causes multiple ovarian cysts that do not release eggs. To overcome infertility caused by PCOS, you need proper treatment from a doctor. If obesity is a factor behind PCOS, addressing it will help. Heavy or irregular periods. Regular periods are a sign of a healthy working body. Unless you're pregnant, breastfeeding, postmenopausal, or have a medical condition that causes your period to stop, you should have a regular menstrual cycle. If your next period is less than 24 days or more than 38 days, you could be experiencing irregular periods. Irregular periods are common during the first few years of starting menstruation, while the last few years of menstruation are known as perimenopause. There are various underlying hormones that can cause heavy or irregular periods. Depending on the type of hormonal imbalance, there are medications and lifestyle changes a doctor can recommend to control this imbalance. Hirsutism, or excessive body hair. It is natural to have body hair, but if you notice excessive growth, chances are your hormones are acting up. Hirsutism is characterized by thick, dark, and coarse hair growth that appears where hair isn't common. These body parts include the face, chest, back, inner thighs, and lower abdomen. Hormonal imbalance is the main reason behind this, but there are various reasons behind hormonal imbalance. Women with polycystic ovary syndrome, PCOS, have an imbalance in sex hormones. This can cause excessive hair growth, irregular periods, and obesity. If your body has been exposed to a high level of cortisol, it could lead to a condition called Cushing syndrome. This also results in hirsutism. Another reason for excessive hair growth is the abnormal production of steroid hormones, cortisol, caused by the inherited condition congenital adrenal hyperplasia. Androgen-secreting tumors and medications like minoxidil also lead to excessive hair growth. When androgen levels increase, other symptoms of hirsutism also appear. This includes deepening of the voice, acne, increase in muscle mass, and balding. If you notice excessive hair growth on your face or body, it might be a symptom of an underlying hormonal problem. Visiting a specialist might solve this. Skin darkening. Skin darkening, also known as pigmentation, occurs in women due to hormonal imbalance. In fact, it is called hormonal pigmentation, also known as hyperpigmentation. It causes a change in skin color that is noticed in the form of patches. These patches are brown in color and can be easily spotted. They mostly appear on a woman's face. Hormonal pigmentation can be brought on by an imbalance. This is due to changes in levels of melanocyte-stimulating hormones, increase in the estrogen levels, or hormonal change caused by pregnancy. Prolonged intake of birth control pills can also increase the estrogen levels, causing brown patches on the skin. Hair loss or hair thinning. Excessive hair growth, or hair loss and thinning, can be due to hormonal imbalances. Hormones are chemical messengers that provide communication between cells located in different parts of the body. If there's an imbalance, the body will get the wrong message and its functioning will be affected. So it's no surprise that a hormonal imbalance can cause hair loss. Some of the hormones that can cause this are estrogen, testosterone, insulin, and thyroid. Estrogen is the hormone that makes the hair growth phase last longer, but excessive levels can cause thinning. Its levels can increase or decrease due to excessive weight gain, perimenopause, and pregnancy. Testosterone is mainly a male hormone, but females also produce it in small quantities. When testosterone gets converted to DHT, it suppresses hair growth on the scalp. Though this effect is controlled by estrogen in females, estrogen levels may decrease, leading to hair thinning. Another reason behind hair thinning and loss is fluctuating thyroid and insulin levels. Skin tags. Have you suddenly developed skin tags? It could be your hormonal imbalance. Skin tags, also known as acrochordins, are nothing but soft, extra skin hanging outwards. Skin tags appear on any part of the body, mostly occurring in folds or creases of the skin or places where the skin constantly rubs, like armpits. Hormonal imbalance during pregnancy can be the reason behind skin tags. Also, low levels of estrogen due to menopause can cause the skin to become thin and lose its elasticity. This change in skin, along with fluctuations in hormonal levels, can create skin tags. Even polycystic ovary syndrome, PCOS, caused by hormonal imbalance, can be a factor. Acne on the face, back, and chest. This is known as hormonal acne, and typically testosterone causes it. As androgen levels rise, they increase the production of sebum, which can lead to bacterial colonization in hair follicles. This occurs on the face, chest, neck, and back. Inflammation can also be a result. Sebum is a type of oil the body naturally produces to save the skin from dying. However, excessive androgens stimulate sebum production beyond the amount needed to maintain healthy skin. This increased sebum, along with dead skin cells, clogs the pores of your skin and can lead to acne at the base or root of the hair. Different types of lesions with varied sizes and severity can occur when skin surface bacteria react with these clogs. When the clogged pores become inflamed, they may progress to become papules, pustules, nodules, or cysts. Large and inflamed nodules or cysts can be painful and leave a scar. Night sweats. Night sweats can be caused by hormonal imbalance. Previously, it was assumed that night sweats were due to a decreased level of the estrogen hormone. However, it is now believed that an increased level of estrogen, accompanied by a decreased level of progesterone, may be the reason. A few other hormonal imbalances may also be playing their part. Stress, lack of exercise, and diet can also affect night sweats. With a healthy diet, a reduction in stress, and proper medication to control hormonal imbalance, you can get rid of night sweats. Weight gain. An imbalance in hormonal levels can cause unintentional weight gain. Hormones that affect weight in women are estrogen, cortisol, the stress hormone, thyroid, and aldosterone. One form of estrogen, known as estradiol, regulates metabolism and body weight. After menopause, estrogen production decreases. Due to these decreased levels, the metabolism is affected, and women gain fat around their abdomen. Another reason could be stress. The body increases the production of the stress hormone cortisol. Cortisol is responsible for many bodily functions, like regulation of blood sugar, inflammation, and metabolism. Cortisol fights stress, but long-term exposure may cause weight gain, especially in the abdomen. Another hormone that regulates metabolism is the thyroid. An imbalance in the production of the thyroid hormone directly affects weight gain. Have you experienced any of these symptoms? Do you think you might be suffering from hormonal imbalance? Let us know in the comments below.